Hi everybody, this is Nelson here, founder of Functional Training Institute. Welcome back to Quarantine or Stay Home Pain-Free Series Part 5. Now in Part 3 and 4, I talk about cell myofascial trigger point release. Part 3 was talking about how to release your SCM and your hip. And Part 4 was talking about how to release your psoas, obliques and your chest. Today, Part 5, I'm talking about how to release your rectus abdominal, meaning your six-pack, all the way from your pubic to your sternum. Now, why is it so important to release all these key areas to address flexion related back pain, meaning people with numb and tingling sensation down the leg, slip disc, bulging disc, or herniated disc. All these are all contributed by a lot of postural issue. For example, when you sit on a chair all day long doing your work, watching your TV at the sofa, or lying on the bed, which is all very bad habits. So over time, our pelvis will fall backwards. We call posterior pelvic tilt. So all these fascia line will start to tense up, and when it tense up for too long, and what happens is when you stand up to walk, you tend to collapse your spine this way. All these will compress your diaphragm and your organs, limit your respiratory system, making you very shortness of breath, and affect your digestive system, your bowel movement as well. So same thing, if you do all these heads against the wall, you find that you're not able to extend your spine and move your shoulders because the spine is being jammed up by all the fascia line and the muscles tensing you up this way. Okay, so let's move on quickly to using the therapy ball on how to release your abdominal wall, which is very, very straightforward and many benefits when you release the abdominal, which I'll explain along the way. So I will prefer you to start from bottom, pubic, and move upwards rather than top to bottom. Reason because when our spine is already flexing both ways, like from bottom up or top to bottom, your rib cage is already start to jump up. So if you do from the top, that will give you very little space to work on. So from the bottom up, it's easier. You have more room to work on it as well. So lying down on the mat very comfortably, make sure the two balls are touching each other. You put it right at the pubic there with the insertion of the rectus abdominis. You lie down. You can either put your hand this way, resting your forehead on your hand, and breathe in deeply, into the nose, out to the mouth for 10 breaths or at least 30 seconds. Or you can put your hand by the side, turning your head to one side. Do the same. Inhale to the nose, to the diaphragm, exhale to the mouth. After 30 seconds, what you do is you move down so that the ball will go up to 1 inch upwards, and you turn your neck position to the other side. So stretching your neck evenly on both sides all the time. Take 10 breaths again. And just keep moving. Okay? Or you can always do this. Now, if you find that you want to go deeper to your fascia and muscle tissue, feel free to rock your pelvis from side to side this way. Inhale, exhale. Inhale, exhale. Don't be surprised that you feel one side of the rectus abdominis is more painful than the other side, like almost having a gastric kind of pain, which is very normal because the fascia line is very tight, the muscular system is also very tight. So I want you to do all the way until eventually just before your rib cage, before your ribs. Okay, so the last spot will be just before you touch your rib. So make sure you target the muscular tissue. And after that, when you stand up and you breathe, you realize that your diaphragm can start to function normally because the ball has released the tension and massaging your organs at the same time. Your lymphatic system will improve to help you to remove a lot of toxic and waste from the body. And definitely when you stand up, you realize that your lumbar pelvic rhythm has improved as well because it's no longer locking you down. You're able to move your lumbar pelvic into neutral spine to help you to walk and exercise. And you'll feel a lot more oxygen going through when you breathe in. You'll feel that your breath getting deeper into your lungs because your diaphragm can finally put to normal use for sure. Okay, so try that out, and don't be surprised that along the way you might start to feel a lot of gas coming out, like burping non-stop, like happened to some of my clients. And you'll find that a good benefit of if you have stomach bloatedness or a lot of water retention, you'll find that after doing the release, your bloatedness start to go down as well. And even if you have constipation, this release will specifically help you to clear your bowel and move your bowel. Okay, and Don't forget, as usual, drink lots of water, at least 2 liters a day, to help you to regulate your body temperature, remove all the toxic and waste from the body, sanitize your hand, wear the mask when you want to go out. And in R4, we talk about review, release, retrain, and result. Follow my ongoing series of video. I'm going to teach you some more release, and later on, I'm going to teach you how to retrain and integrate your body into better alignment and neutral position to help you to live pain-free actively at home. Thank you for watching this video. God bless you.